Let's talk about pain today. Pain is the single most important symptom anybody can experience in life, and it is very important. Why? Just think of like after a snake bite, you don't experience a pain. So what will be the consequences? So let's talk about chest pain today. So as a whole chest, there are a lot of organs involved in this area, chest. You see, like we have skin, beneath that we have ribs, muscles, beneath that we have lungs, which is covered by a layer called pleura. Then we have a food pipe, what we call it as esophagus, which is getting connected to the stomach, and we have a heart, which is more important. It is located and safely in the center of the chest. So when we experience pain from the chest, that could be because of lot of reasons. When you experience any severe chest pain from the skin, it could be skin disorders like skin diseases like herpes zoster, which will cause intense pain. When you get chest pain just beneath that, it may be because of, if you have any trauma, you have a fracture, you can get pain from the ribs. You will get pain from the inflammation of the muscles in between from the rib cage, what we call it as a costochondritis. Just go deep inside. When you get pain when on inspiration, like something like pricking type, that could be because of the layer which covers the lungs, what we call it as pleura. It may be because of pleurisy. And pain inside the lungs itself can cause severe chest pain. Conditions like pulmonary hypertension, when the pressure goes more high inside the lungs, we call it as pulmonary hypertension, you will experience chest pain. When you have any huge blood clot which is supplying to your lungs getting blocked, we call it as pulmonary embolism, you will still have chest pain. So when you get pain from the esophagus, what we call it as food pipe, still you can have pain like burning type of sensation. Most of them will have like tell it as gas as a common term. So you can experience pain from the esophagus like a burning sensation. Sometimes it can be because of the acid which gets reflects from the stomach to the esophagus. We call it as gastroesophageal reflux disease. Sometimes the whole esophagus gets inflamed. We call it as esophagitis. Still you have like pain in the center of the chest. Most important thing, when the pain from the heart, how do you experience? So pain from the heart, it will be typically like a squeezing pain, something like crushing on your chest, because when the blood flow to your heart get reduced, there is less blood flow and there is less oxygen supply. The pain will be very intense and will keep increasing time by time. It may radiate to your shoulders, you may ask, or to the throat, or to the jaws, or to the back. Sometimes you will experience like severe profuse sweating with breathing difficulty. This is typical signs of angina, the pain which you experience from the heart. And pain, when you have very sharp pain here and radiating to the back, it may be because of a pain from the aorta, what we call, there is a big vessel going out of heart, which is a aorta. When you have any rupture in that, still you can experience a severe pain, which will be like central chest pain radiating to back, which will be like typically tearing pain. But unfortunately, everybody doesn't experience all this pain described as I told. Different people will have different symptoms. Unless you have very severe block in your heart, you will have severe symptoms. When the block goes very minor to the heart, you will experience very little bit of symptom. So it's always better to evaluate your chest pain then and there without wasting any time, and we are there for you.